Imagine you are over 4,000 miles away from home and the doctors tell you you have the dreaded C word. Cancer is something everyone hopes to never go through. With cancer comes treatment, and with treatment comes chemotherapy. This is exactly what my aunt was going through, and with this life-altering news, my family knew that we would be going with it too. Multiple people in my family have had cancer, so I know first-handedly what chemo can do to people. But on the bright side, chemo is a useful medicine that many cancer patients do have to use. Today I will discuss the development of cancer and how it started as a protectant for the Army, but it turned into an effective use for cancer, the ability to be treated depending on the type and stage, and the several things that people today go through with chemotherapy. Let me begin with the development of chemo. According to Dr. Ananya Mandel, in World War II, Navy members were experiencing high white blood cell counts and their bone marrow cells were turning into blood cells after being exposed to mustard gas. At the same time, U.S. Army researchers were studying chemicals to develop protective measures against this gas. The compound nitrogen mustard was discovered. This compound was also found effective against lymphoma, which is cancer of the lymph nodes. Nitrogen mustard was a model for the effective agents that were like nitrogen mustard that damaged rapidly growing DNA cancer cells. Sidney Faber, a researcher from Boston, found that aminoterrin put children with acute leukemia in remission. Researchers then developed drugs imperative to blocking functions that led to cell replication. In 1956, metastatic cancer was cured. In the 1960s, patients with Hodgkin's disease and children with acute lymphoblastic leukemia were gifted with long-term remission, and some were actually fully cured. In the next decades, cures for testicular cancer were discovered. Now that you know about the development of cancer, let me explain what types and stages of cancer can be treated. Karen Selby, an RN, said whether or not a patient can be treated depends on the stage and type. American Cancer Society gathers data from their patients and reports treatment patterns for specific cancers. Data was collected from 2019 to 2021. To name a few, bladder cancer, stage 0, 33% of their patients use chemotherapy. Stage 1, 50%, stage 2, 55%, stage 3, 61%, and stage 4 of bladder cancer patients were cured with chemotherapy. To compare another cancer to bladder cancer, rectal cancer, stage 0, none were reported for their data. Stage 1 cancer, 34% of their patients use chemotherapy to be treated. Stage 2 is like stage 0 and none were reported. Stage 3 had 79% and stage 4 had 78% of their patients use chemotherapy to be treated. Now that we've talked about what patients can get treatment, let me describe what patients experience while going through chemo today. Yvette Fraser once said, first, patients must realize the severe side effects of cancer. The side effects are so severe because chemotherapy targets both healthy cells and cancer cells. Patients will have individualized treatment plans created by doctors. Depending on what stage and type treatments, treatment can range from one single dose a day to one single dose every few weeks. Patients are given ample time to recover since chemotherapy is so harsh on the immune system. Blood tests are taken whether to see a patient can handle the side effects. The liver is tested because the liver breaks down the chemicals from chemotherapy, and the blood cell counts are checked specifically to make sure that they don't go too low while receiving chemo. Doses are given in several ways. The first way is by mouth. The second way is by IV, so it's an injection or an infusion. And the third way is topically, like in an ointment. According to Yvette Selby, the side effects are nausea, vomiting, hair loss or thinning, brittle nails, hearing loss, infections are easily contracted, excessive bleeding, easy bruising, loss of appetite, fertility issues, bowel problems, and mental health issues. One of the big side effects of chemotherapy is anemia, because it also leads to fatigue and easy bruising and excessive bleeding, and it is caused by low red blood cell counts. These can be improved by eating iron-rich foods such as beans, nuts, and dark leafy greens. Allow me to finish by saying the development of chemo started as a protectant to Army members, but was found effective for cancer patients. Depending on which stage of cancer you have, depends whether or not you can receive chemo as a treatment. And there are several things that cancer patients today go through with dealing with chemo. On the bright side again, chemotherapy is a useful medicine that is commonly used with cancer patients to help them survive and live longer. And chemotherapy has become a life-changing treatment and would not have been possible without the research of the World War II researchers. Thank you.